Morning, welcome everybody. Today is February 16th. This is our bi-monthly Central District Health Board of Commissioner meeting. I'm going to call a meeting to order and have roll call. First up is Ada County, Dr. Ryan Cole. Dr. Cole, are you on? Okay, Dr. Greg Furch. Here. Dr. Jane Young.
Here.
Boise County Commissioner Tucker. Here. Elmore County Trustee Betty Ann Nettleton.
Here.
And Board County from Elmore County, Crystal Rogers.
Here.
So we have a quorum. At this time, I would please entertain a motion if there's any changes to the agenda. We have none. We have a misprint on the agenda at our 1050. That should read 2024 budget, not 2023. So if everyone's good with that, I need a motion to approve the agenda with that change.
Make that motion.
I have a second.
Second.
Moved and seconded to approve the agenda with the one slight amendment. All in favor, please say aye.
Aye.
Those opposed, motion passes. Okay, next agenda item is the discussion to vote on the December 16th Board of Health meeting minutes. Everyone get those?
Yes.
If that is good with everyone, I would entertain a motion to approve those minutes of December 15th, 2023.
This is Betty Ann, so moved.
Second,
Second.
moved and seconded. Are we supposed to do these by roll call? Okay, all in favor, please say aye.
Aye.
Aye,
Aye.
motion carries. County, they brought me a stamp. Like it's going to trouble. They just signed so much stuff. Today is the 16th. Name is too long. This is for you. Okay, before we move on into an executive session, I would like to go around the room and have everyone introduce themselves. So we know who's here.
Go ahead. Yeah, I'm Curtis Lovelace. I'm the Division Administrator for Community Environmental Health at Central District Health.
I'm Stephanie Myers. I am the Family and Clinic Services Division Administrator at Central District Health.
I'm Laurel McMahon. I'm the Division Administrator for Support Services here at Central District.
I'm Pat Duncan. I'm a consultant with Calyx Weaver and Associates. I'm Patty Perkins. I'm also with Calyx Weaver.
I'm Kane, Board Counsel.
Hey, welcome everybody. Thanks you guys for being here. Is there anyone online that somebody's trying to say something? Nope, guess not. Okay, so our next agenda item is an executive session. So at this time, I'm going to make the motion that we go into an executive session under Idaho Code 742061B and Idaho Code 1F 2061F to hear complaints or charges brought against a public officer and or staff. Do I have a second?
This is Betty Ann, I'll second.
Okay, we have a motion and a second to go into an executive session at this time. By roll call, please, Dr. Birch.
Yes.
Dr. Jane Young.
Jane Young, aye.
Thank you. Yeah, you need to say, Dr. Birch, aye. Please.
First aye.
Okay, Commissioner Tucker.
Commissioner Tucker, aye.
Betty Ann.
Betty Ann Nettleton, aye.
And Chris.
Rogers, aye.
All right, so we are in executive at 8:32. Man, we are moving.
Who do you want to stay?
So I would like, Hey, welcome back, everybody online and in the audience. We are out of our executive with no action taken. We're going to move on down our agenda. The next item on our list is to approve and vote on, the audit report. I was going to say 21-22 Central District Health Audit Report. I thought we were. And as you guys remember, years ago, the state legislative services used to do our audits every 2 years. And then we wouldn't see them for another 2 years after they did it. So they were like 4 years out. This didn't work out too well. So now we do our own audit. This time, Laurel, I'm gonna turn it over to you.
Thank you, Commissioner Hasbrook. So if you recall, we went out to bid for our audit for the past 2 fiscal years. We had Harris CPAs perform that audit. They presented the report at the December meeting. And Commissioner Hasbrook, you asked that we make it an action item to accept the results of that report. Highest level summaries, there were no findings for the fiscal years that they audited. And they prepared a letter and financial statements, which we have available if you would like to see them, but we presented them at the last board meeting. So this was just the formalization of asking the board to accept the audit performed by Harris CPAs.
And you said that cost how much?
I do not remember. It's to go out to bid is cheaper than using legislative services office, but
It's 22,000, 23,000.
More than
it was more than that.
The reason I bring that up,
I can provide that.
well, it's okay, maybe send it to me later.
Yeah.
We just got ours back. And we've been using Zweighart and Associates, and this year it was 18,500 for the county and about 3,000 for EMS. And then we also did an audit on our fair budget. So the whole thing was 22,000 some change. So next time we put the bid out, maybe we can send one to Zweighart as well.
Yes. Yeah, we used them the audit before Harris CPAs, and we plan to go out to bid again, and we'll consider whatever bids come in, including Swigert.
Okay, everybody understand? Everybody good? I would entertain a motion to approve the 21-22 audit. Second. Moved and seconded. All in favor, please say aye.
Aye.
Anybody opposed? Motion carries. Okay, gonna keep right on going here. Next agenda item is a review and discuss the 2024 financial report. Laurel, go ahead. Oh, there it is.
We do have one in your packet. The one that Donna is passing out right now is a correction of a formula error on page 2. So this is one that you're getting in your hands right now is the one to use, please, and
So the packet is not good.
correct.
Was it that personal cost?
Yes, it was, yeah. Yeah, that was like, it was something stuck in computing. Didn't look like that in the spreadsheet, but it turned out like that in the PDF, but we were able to catch it and get a corrected version. So thanks to Dustin and Donna and Corey for getting that corrected on page 2. And you have the correct formula version in front of you. So we'll just go through it as we normally do. This report is through the end of January, which is 58% of the fiscal year. To start off with, I'd like to provide a little bit of a LUMA update, similar to what I've been doing the last couple of reports. So LUMA has acknowledged, or the SEO has acknowledged, that the health districts and other state agencies continue to have the same issues with LUMA and that some of them are not working for standard business operations. So their solution to that has been that they're assigning a liaison for the health districts to address the health districts specific LUMA issues, which is fantastic. So we've had one call with them so far where we got to outline the biggest issues that we're having that are interrupting our business operations, which continue to be interagency billing, being able to see when things go through and don't go through, P cards, and then not having the right level of detail of reports to be able to see at the object level where costs are going and coming from. So we've reported those major issues to LUMA. It's big stuff. It is. And yeah, we'll talk about that a little bit more as we go through the budget revision. But the nice thing is that the SCO has recognized it as an issue. They're not saying just use it as is, and you'll continue to get to know if they recognize where the issues are and are proactively assigning a liaison to the health districts to address those issues. So we appreciate their willingness to hear our level of concern with it and address the issues that have come up. So that's where we are. There are still some lags in both making and receiving payments. So as we've talked about the last couple of, my chair is a little bit lower than normal. Oops, a little.
How we can duck.
Yeah, if I need to. We are confident in the overall numbers as they roll up for both revenues and expenditures. Some of the subcategories may still be experiencing some miscategorization. We're trying to fix as much of that as we can during the budget revision. But there are still some areas where we know some things are a little bit off, but we're confident in the overall numbers that they're rolling out to. So that being said, our overall revenue percentage, if you look just across that top row, is coming in at 57% of where we plan to be at this point in the year, very close to being 58% of the way through the budget year. After this report was prepared, this is again through the end of January, we received a payment from Ada County, which would put us over where we plan to be at this point in the year. It's not reflected in this report. Because we'd be at about 60% for revenues received.
And you just get our half.
We probably did. I'm not sure when it
Yeah,
was
it just
received
went
and
out
accounted for in
on
the system.
Monday.
Okay, then yeah, that wouldn't be showing up in this report then
Okay.
either. So fees are showing an increase from last month. You can see in community environmental health, they're significantly up. You'll see that when we get onto page 2 as well. That is because we are in the midst of renewal season and receiving all those fee payments in that we normally do this time of year. For family and clinic services, we're still lagging a little bit behind where we plan to be for fees at this point in the year. But when we look at page 2 for that one also, you'll see that it's a big increase from where we were a couple months ago. And that's due to that increase in number of appointments and revenue finally coming in from that as well. We do have our interest revenue reflected on this month. It was not there during the last board meeting, but we've been able to receive that in, get it categorized correctly. It's now showing quite above where we had planned to be at this point in the year. So for the last 2 fiscal years, this one and last year, our interest revenues have returned back to where they had been 2 years ago and are now exceeding what we planned for them to be.
That's really good news.
Yes.
That is really good news.
Then for the expenditures, still on page 1, for expenditures, our personnel costs are at 53% of budget. Been seeing that the last couple of fiscal years as well, that we're behind where we plan to be for our biggest divisions for community environmental health and family and clinic services. We'll be making some changes to that with the budget revision. Capital costs are lagging behind where we plan to be. We will also talk about that budget revision, as we'll be asking for an increase in capital related to our we'll be making for some increased funding for the mobile van. So you'll see a change in that. I'm just planting these seeds so you can know what to look for. So overall expenditures, we're at 54% of the way we plan to be. Where we plan to be. Okay, now moving on to page 2.
Like, we've been affected by the Blue Cross building, the family and clinic services when they're not paying claims this year yet.
Going to say no, but Stephanie confirmed it. I hadn't been made aware of it, and no, not.
Is this something new?
Knowledge.
They're putting in a new computer system, so they haven't paid any claims this year.
No.
But that would account for part of the report.
No, this is Blue Cross, not Blue Shield.
Blue Cross.
And we're using MedMan for our billing vendor. So if they have heard of and or experienced an issue with it, that hasn't been passed on to us, and we wouldn't have seen it directly. They are
announced.
Okay.
It's just figure it out when it isn't there.
Certainly ask them about it and see if there is a lag in that. It could explain some of the gap.
Blue Cross also is one of our smallest payers, so 5% or less, so we wouldn't see huge impacts. Self-pay is our biggest payer, so.
Okay, so back to page 2, in comparison of the last 2 years, you can see for our fees, we continue to be significantly above and just really on that upwards trajectory from where we've been. This has been the trend since I've been in this role, that our fees just continue to increase year over year. We see the big increase in our food program, and that's again the reflection of being in renewal season. All those payments are coming due right now, so we always see that big increase right now, and then it'll kind of drop off for the rest of the fiscal year. Looking at our contract amount, again, we continue to see that the grants that we're getting in, federal grants, are increasing year over year. Russ and I were talking about that a little bit this week. We really expected during the pandemic and right after to see that increase in federal funding and then for it to sort of level off. But thanks to some of the work that grant writers doing and growth of our programs, we do just continue to see that increase even where we didn't necessarily expect it to continue at the same rate. So that's been great. Looking at our personnel costs, and this is where the error occurred, where you have the corrected portion now. So it shows that the current spending is at 53%, which we saw on page 1 as well, and that our completed pay periods at the time of this report were only 42% of the way through the year. That's okay. So it shows that we are overspent on personnel, and that is a reflection of having paid out the retention incentive in the January paycheck. So we're still behind where we plan to be at this point in the fiscal year, but ahead of the completed pay periods because of that retention incentive. So I just wanted to point out why there's that gap there and why that's different than the percentage of completed pay periods. Okay, and then again, we see at the bottom of page 2, our capital outlay is significantly under budget, and that's where we'll be asking for those band funds when we get to the budget revision part. So moving on to the cash balance statement, total cash balances at month end coming in just over 9 million. That cash balance is all either restricted or designated with a deficit of about 386,000 that you'll see at the very bottom of the page. I just wanted to, this is the second report in a row that we've had that deficit at the bottom. So the reason for that, one, that Ada County payment is not reflected in there. 2, this is all funds that have not been spent, but they're either restricted for spending in a future year or allocated to special projects. So we are showing that there's a deficit in our cash balances, but we're not actually in a state of negative cash flow. So that's why it shows there. Again, once that Ada County payment is reflected in the notes or in the budget, you won't see that deficit again and for year. So that's the last time you should see that on there. And again, not negative in our actual cash flow, just that a lot of those funds have been designated. I have updates on all of our special projects and our carryover designations as well. So for our environmental health systems upgrade, we have had a couple of meetings since the last board meeting and decided for sure that we would like to go with an off-the-shelf vendor product for environmental health system. So we have 2 meetings with vendors set up for early next month, where we'll be looking first look at those products. And right now we have an in-house built system that only a couple of people in the state can work on. It's working for our needs, but it was built just for us. And every time there's a need for an upgrade or something breaks and needs to be fixed, it's difficult to get those fixes in place. So we, as an agency, feel much better going with a product that was designed and built and that other people are using for inspections, rather than continuing to upgrade the in-house product that we built ourselves. So that's been the decision. And we'll be talking to vendors going out to bid, formal bid in the near future on who to select for that. We can also work with the state to have a vendor assigned if we need to, but more than likely we'll be just doing that an off-the-shelf product. And we've been talking to the counties as well to see what they use. I believe the first vendor that we're going to be talking with provides the service for Ada County. Could be Valley, I'm not sure, but was it Ada? Okay.
Who was it?
Aleco or something.
Okay.
Yeah, we just scheduled it, so don't have all the details on it, but yeah, something like that.
Well, it's crazy because like in our county, like the state, like us, we're all updating the software programs. And we went with a company out of Texas called Tyler Technology, and they have a lot of, I can't remember what they called it, but software programs that you could buy for like building department or I'm gonna say dump, but it's not the dump, you don't call it the dump anymore. You know, those kind of things and I don't know if they have anything that would work for you guys, but.
Yeah, we're looking for a system that is modular like that and has modulars that we could
Yeah,
select it
modules,
and use for our needs. So I'd be happy to get that information from you if you could provide it.
I can, I know we bought a module for our building department, and I think it was 60,000 for that module.
Okay.
And it's important that the building department talk to planning and zoning, that talks to the assessor, that it talks to, I mean, everything's got to flow through to the audit.
Yeah.
So far.
That's exactly what we need. We need that flow through. We need the ability to complete reports the way that we need to report them to Health and Welfare and our other partner agencies, and we'd be able to accept payments. So those are kind of the modules that we need to have.
Well, I would recommend that part of that contract, that they, if there's any issues, that they send somebody up to help you with it. There's no extra charge for that. Because we're having to pay for them to fly people out different areas of the country to help us with different things. It's like, we didn't anticipate that cost. So in that contract,
Yeah.
think about that as well.
Employee retention, our special project there, those, we use the funds that were designated for that. That went out in the first January paycheck. And again, thank you for supporting that. That makes a big difference in that first paycheck of the year, and that board has supported that for 2 years in a row makes a huge difference to our employees. So thank you for your continued support on that retention incentive. And then the van purchase, so you know, we haven't touched those funds yet. Stephanie will be doing the next presentation, which will show you those quotes that we got in and what the features are for our different options. And then we'll talk about a little bit more in the budget revision and the requests that will come along with that. So we'll, I guess, save the update on that for after she presents. And then none of the other reserve fund designations have changed. So that's a summary of the cash balance statement and the budget to action report.
Any questions for Laurel? I think it all looks pretty good. The 381,500 in the operational reserve. I know it's 4 million, but the 381 was the 3-month target for employee pay and all that stuff, right?
Yes, the 4.3 million is the 3-month cash flow target.
That's included in there. Okay.
Yep, and we revised that at the end of the last fiscal year to accord with the bigger budget. We had left it static I think just for one fiscal year, but we reassessed and had asked for an
So
increase to
did
that.
you use that to pay Luma couldn't pay?
No, Luma has been able to pay our paychecks for us.
So we're all caught up.
Yeah, we're caught up with that.
I know that came up in the legislature. There were some people pretty upset about that.
We had a handful of employees who missed 1 week of a paycheck a few times. So internally, what we've decided to do on that is have more cash on hand so that if that does happen, we can have an employee have that cash available to them for the short duration. Anytime there has been a Luma error on somebody's paycheck, they've paid it out the following Friday, though. In between pay periods, they haven't had them wait the full 2 weeks. So they are very responsive when any of those errors have happened. So we want to have a little bit of extra cash on hand, have an employee have the ability to sign to receive that if they absolutely need it. But at the same time, Lumen has been very responsive for the few times that has happened.
Okay, if there's no more questions on that, there is no motion need to be made. That was just, there's no action item taken. We'll move on down to the next agenda item. Steph, come on up. This is review and discuss medical van. Got a picture for us?
Oh, I do. So exciting. I mean, we couldn't bring any of the bands here, so I know I disappointed at least one person. But I have obtained 3 quotes for medical mobile unit for us to deploy so that we can use in all 3 counties. Dustin, if you want to hit the next slide for me. So services to be provided with this van, just so we're all aware, are immunizations, community outreach, and events within all of the 4 counties, health screening, and then also mobile outreach for our WIC program where we can show up to different sites, including apartment complexes, to offer WIC services there. So next slide, Dustin. So our first option 1 is from Summit Bodyworks in Denver, Colorado. This van is already put together and is on the lot ready to deploy as of today. It's equipped with an electric awning, gas generator, rooftop air conditioner. It includes all the machines to take vitals as well. This has a refrigerator and freezer for immunizations. However, it's not equipped with a hand washing sink. And there is no ramp for loading equipment. And then also there's not steps. So for people with mobility issues, this might be a little bit challenging. The cost is $196,600. And if you go to the next slide, Dustin, we can see some pictures of this van. So this van is a little bit different than the other ones I will show you. As you can see, that middle section is pretty narrow where you would be able to get someone with mobility issues in there. Also, it doesn't have steps for the front entrance, but as far as the features go, it is very nice. It has all the equipment to take vitals within the van. It has a privacy curtain. But because of not having steps, not having a hand washing sink, I don't recommend this one. So I don't know if anybody has any questions, but I feel like there's a gap. We want to be able to wash our hands when we go to events, especially doing medical screening immunizations. We want to have that capability.
Well, I'm more concerned about the ADA accessibility. How do
Yeah.
you get somebody in a wheelchair in that?
Yeah. And I don't see this one as an option. Also, it was very narrow in the middle. So I think even if we installed a ramp, I do not think a wheelchair would fit in that space. You want to hit the next slide, Dustin? So the second option comes to us from Craftsman Industries. So this is one that we would need to get a vehicle, so they can order a vehicle or we can, and then it would take 6 to 8 weeks after receiving a van for them to install everything. But the pictures I'll show you on this one comes with a 14-foot power awning. It comes with a refrigerator and freezer for immunizations. It comes with full graphics, an HVAC system for heating and cooling, a sink. It has a freshwater tank, water heater, and a gray wastewater tank. But again, this one does not have a ramp. So the cost is $238,995 on this one. But initially it didn't have a refrigerator and freezer in the quote. So it's $3,000 additional to add that refrigerator and freezer. You go to the next slide, Dustin. This has some renderings. So this one does not have a back entrance. So the back of the vehicle has the HVAC system. It does have a ton of cabinetry in here, which I love, but also again, there's one point of entry. It does not have steps. You want to go to the next slide for me, Dustin? So as you can see, this one has a little bit more space. That has a seating area for a patient where they could come sit down and get immunizations or talk to a provider, do those health screenings. And it also has a workspace for medical or clinical staff that would be sitting in there. So because this one also does not have a ramp, steps, this one also only runs if we have power hooked to it or the engine is idling. So it does not have a generator, which could be challenging if we're at an event that's a long time and we don't have access to power. So for those reasons, I'm not gonna recommend this one either. I don't know if anybody has any questions. Okay, and then if we can do the next slide, Dustin. So this third one is gonna be a recommendation I have. We have the choice of having a 2023 to 2024 Sprinter 2500 van or a Dodge ProMaster van. They're a little bit bigger than those Ford Trans vehicles from the previous two slides. This one comes equipped with a 14-foot electrical awning, full graphics kit, a refrigerator, freezer for immunizations. It does have an ADA lift, which I'm super excited about. Has an HVAC system for heating and cooling, a sink, freshwater tank, water heater, gray wastewater tank. And the cost for this one is $229,805. Dustin, if you could go to the next slide. This is one of their vans they've done recently for Eisner Health. Not sure where they're located, but it has steps to get into that first access point. And then on the back, it does have that ADA lift, which would be great to anybody in a wheelchair, but then also for us to load some of that heavy equipment, like a dental chair. If we wanted to take that somewhere, we could load it in very easily. Has a patient blood draw chair there, which you can use for drawing blood, giving immunizations. It's really comfortable, but then also you can take it out if need be, if we were going to a different event where it wasn't needed. Also, some great things about this is they had a lot of different colors. So you can pick cabinetry colors, countertop colors. They have about 6 options for each thing. None of them were at additional cost. I liked it because they had all the CDH colors as options. So it's just, oh, okay, I have some really good signs about this that we would be able to incorporate.
Stephanie, I can't tell from here, is that a Dodge? Or is that the Sprint you were talking?
I can't tell which one that is.
It looks like a Dodge headlight, but I can't.
And they've been really great. They've sent me other vans that they've done as well, and they're all just really great quality vans.
It's not 4-wheel drive though.
It's not. So the option though with each of these places is we have the ability to pick out a van that meets our needs. So they quoted one of the highest costing vans. I don't know that they're 4-wheel drive, but there was an option for all-wheel drive. So that was really exciting. So we can also still pick out the van, pay for it, and then they can do all the manufacturing with it.
Well, I'm not sure we need a 4-wheel drive van, probably, maybe sometimes in Hawaii County and certainly up in McCall area in the wintertime, but I'm not sure we'd be taking it up there in the wintertime. I know we're in the process of purchasing a similar van to this for transporting prisoners, but then you buy a unit that slides in the back. So the goal is 10 years from now, when the van is wore out, you can pull the unit out and slide it into a new one. And you can transfer up to, I think, 9 inmates at a time. Inmate transportation is very lively, but.
Corey said that it's a Sprinter.
Thank you.
So a Sprinter is
That's the picture.
a
That's the
Dodge
picture.
product?
No, there's Sprinter or a Dodge. So we have the choice of 2
Who makes the
different.
Sprinter?
What?
Who makes the Sprinter? What's your company?
Mercedes.
Oh, Mercedes. Ooh.
And I think that was even cheaper than the Dodge one. I could.
Oh, I see. Yeah. I see him down along State Street there, that kind of van.
So this one, when we're able to get the van, it takes about 8 to 10 weeks to fabricate it before it's ready to be driven off of their quad production facility.
And then we have to go get it, I'm assuming, or will they deliver?
Yes, so there was an option for delivery. We felt it was pretty expensive, where it would be cheaper for us to send one of our employees to go to the facility and drive it back. It was around $10,000 to $12,000 to bring it here. So
Felt like a good job. I wouldn't say it. Need a vacation? I need to drive. Yeah. So what do you guys think? They're all within pretty much the same cost.
To give you a time frame on the actual getting the vans, sometimes the production on that part is going to be longer than actual outfitting.
Yeah, that's a great question. I touched base with option 2 and 3 this week, and they said they have vans on the lot at their local dealerships. And so that as of right now, it wasn't a problem that they said I could check with them. But that was a good question. I had the same one.
Yep.
Okay, so when my commissioners talked to me about this position, budgetary issues were prime. And I know I'm coming to this process a little late, but was the default position to investigate brand new vehicles from dealerships like this? Because when I saw this coming up, I paid attention to an article that came out and it says BLM transfers engine to rural partners. So my question is, did we explore used vehicles or procuring from other government agencies at lower cost and then, modifying the vehicle at less cost? And so we're not tapping out the 200,000 end of the spectrum. I think when I was here in the informal capacity, the first conversation was around 100,000. And then within a month and a half or 2 months, now it's over 200,000. And did we, at some point consider used vehicles? Because it took me, 15 minutes to, look at a vehicle like this that's $80,000 and has refrigerators and sinks. Now, it may not be as purposefully set up as a manufactured one, but if we're looking at hundreds of thousands of dollars of taxpayer money, were some of these other sourcing options investigated in this process?
Not used cars. They can see that. I don't know what the buying process is here for used cars. We did initially look at vans. We wanted to purchase the one. We figured it would be a lower cost for us to purchase a van and then get it manufactured. But we ran into a hard time getting everything we needed and someone local to do that manufacturing. It was challenging even for some of the RV places to give a quote to do all that install work. Or one I reached out to was like Fish's RV, because I figured they would be able to install a sink, Great Waterways tank and all of that. And it was around $25,000, and that was just for the sinks and nothing else. When you're looking at the cost, $70,000 to $80,000, it was just for the sink, 25 grand. So I don't know if that helps. If that's a decision the board wants to go, we can definitely do more research. I think we reached out to a lot of different places that manufacture these vans, and it wasn't as easy as I thought it was going to be to find someone to manufacture with everything we need. I think also one of the challenging parts is we want to ensure this van is usable for all the programs. So I had to get that feedback from everybody, which was huge, and really narrow it down to what do we absolutely need? What is the work we're doing right now, not future work we may be doing down the line, to minimize those costs as much as we can.
And I'll add to that we did look at the state surplus site as well as one of the very first things that we did, just to see what they have available. And every once in a while, there will be an old ambulance that pops on there, but not other, and again, those are high mileage. They've been through a lot of wear and tear. They are very cheap, but they're used ambulances. And again, the modifications that it would take to get them usable for the purposes that we want to use them, attract clients and customers. We believe that these options are the best options for what we want to use them for, and that they will last a long time into the future.
And I appreciate your comments, because we all pay taxes at the end of the day. The thing that I think has impressed me about this is all the things they want is already put in it. I mean, the AD access, the wheelchair lift, all that's going to be part of it. The other issue is that I think this is going to be kind of the face of Central District now. I could see this at a lot of events, football games, all kinds of things. And I don't know if I want to go out with some old used ambulance or old beat up you know, piece of equipment that dies on the road somewhere someday. So,
Well,
Well, and now how much it costs to get the refrigerator freezer organizations is not likely we're getting it wired. For the right temperature, something that's not taken lightly like every refrigerator.
Yeah, and it's not just a refrigerator, it has data loggers, so we can make sure it maintains the correct temperature throughout the drive till we get to the event.
is this a plug-in or a generator?
Great question, it has both.
That's both, okay?
how about the ancillary costs like dump stations and, you know, insurance and, you know, how many days of the year do we anticipate this thing doing something? And, you know, getting, if we are going to consider something that's wrapped and so forth, and are we gonna get the $200,000 worth of use out of it?
That was, I know, Russ and I's biggest thing. We wanted to make sure it was utilized and it was set up so all the programs can use it. So right now, our oral health team goes out every week. They're at least at a school, a daycare, or another facility 3 days a week. So having that ability to transport, our immunization team is also out at minimum 3 times a week doing immunizations, schools, Valley County, Boise County, Elmore County. They're constantly driving places. So those are the 2 highest utilizers that I'm sure are going to be fighting over this on a day-to-day basis. And then, of course, we are always going to events, but one part right now is we have a challenging time going to some events where they're outside. And bringing those immunizations in a cooler is not ideal. And so this will allow us to get to other events that we previously haven't been able to get to.
So it sounds like there's some overlap in scheduling. How are we accommodating now with, if some dental team is going here and some immunization team is going there, how are we?
Right now, they're using anywhere between 1 to 2 SCVs, depending on what they're bringing. So our dental team has a lot that they pack up to go with them. So sometimes that does require them to take 1 car and put all the back seats down to load it all in. The CIO team, community immunizations and outreach, they usually take 1 car, but it's filled to the brim of stuff.
And they're setting up in a facility somewhere.
Yeah, so sometimes it's at a school. Sometimes it's outside of the school. They won't give us space for like the immunizations team, so we'll throw up kind of a pop-up tent. I'm trying to think of what that's called.
We have a wall tent if there's need for
Privacy.
privacy for any testing that they're doing. That's been something relatively new, but again, not ideal for some of the interactions that we have, but the EPI team especially is using that. And yeah, but there is overlap. Our current system for signing out vehicles is what we plan to use, that you sign them out for advance. We've also built a calendar of our outreach events in the last couple of months so that everybody can see what events are coming up across divisions, across teams, and coordinate if we need to. So we'll plan to use those things, but I anticipate there will be some days that it's highly contested.
But then that leaves the other
It does, yeah.
going in the filled up car to the school.
Yeah, we still have our standard fleet of vehicles. We're not planning to reduce that fleet size or get rid of the pop-up tent or the other options that we're using now.
Well, Dr. Virtue, are you catching a lot of heat from your commissioners about this?
I've explained to them, yes, I've kept them appraised of the conversation and the original 100,000 and the 200,000 and, you know, yeah. And even before that was announced, budgetary issues and being mindful of taxpayer money was one of their primary kind of directives when I first interviewed with them. And then, you know, personally, I tend to lean very judiciously with taxpayer funds, and you know, partially to me, I'm not opposed to having a modest vehicle that goes out. I you know, you said, the face of CDH, and maybe I don't necessarily see it that way. You know, if we're out there delivering services, I'm not necessarily certain that my perspective, deliver it like flashy and, you know, here we are, you know, there's maybe an appreciation for the services that are being delivered and less concern about the fanciness and the way they are being delivered, and maybe focus on that less than the delivery service. But my perspective, I've seen situations where money is, services have been spent, and, you know, they be state, if I can. Somewhere I have a picture of, you know, the state's health district or health and welfare was wrapping icebox at the stage stop, truck stop, and get the shot, right? And they were promoting the COVID shot by wrapping an icebox. And, you know, really, even if the shot actually was effective, is that appropriate use of taxpayer money to market and educate people by literally wrapping an icebox, ice cooler at a truck stop? Is my perspective. I'm going to be mindful of that utilization of resources.
Any other comments? This is not listed as an action item, so can't really vote today.
We will be discussing it in more detail in the budget revision, which will be an action item.
Well, I guess the only thing that comes to my mind is the 300,000 in interest that we made this year. That we normally don't have that much in interest income. So I think budgetarily wise, we're not, you know, it's kind of taxpayer money, but we've done a good job on our investments where we have some interest income. And I think this is a perfect use for it. I think it's going to help the morale of the employees that go out and do these clinics. Instead of doing it in a small tent, they're going to have a nice warm vehicle that they can do it. That's going to be a lot more professional, I guess.
Nice.
But, so you want to wait till we do the revision and then
Yes, please.
we can make a motion then? Okay.
Thank you.
Thanks, Stephanie. We'll move on down, discuss and vote on the FY 24 budget revision and reserve fund designation. If I can find that. There it is. Okay, go ahead.
Thank you, Commissioner Hasbrook. So with our budget revision request this year, it's a fairly simple revision request. I'll talk first about the van so we can just have that continuity from the last discussion. So as we have talked about for all of the budget to actual reports so far this year, our spending and personnel has been down from our planned amounts. So we are requesting a reduction in our personnel expenditures of about 105,000. And that money would be put into basically the capital outlay. You see $78,000 request difference there. And that's where that extra 125,000 for the van would show up. If you recall from the budget to actual report, we've only spent about just a little over 6,000 in our capital outlay. And we initially had a budget of 100,000 there. So the difference of what we haven't spent in capital outlay and moving those funds from personnel to capital, and some go to operating as well, but that's a different change, gives us more than enough to allocate an extra 125,000 to the van if you choose to support the budget revision request. So it shows up as just $78,000 positive requests for change in capital outlay and a difference of 105,000 in our personnel change that we're requesting. And the additional funds that we've gotten in this year are primarily in grants or contracts that we've gotten from health and welfare. So those are federal grants. That's an increase of 217,000. Overall, we're looking at a budget increase of 252,000, and that is coming in again from grants and contracts that we weren't planning at the beginning of the year. That does include our interest revenue. And
Well,
any other.
where is that interest? Oh, it's right there.
So if we go to the second page of this, you can see it broken down by divisions of where the changes specifically are requested. So we'll look at support services first. We are looking at cumulative difference in personnel, but or negative difference in personnel, but asking for 30,000 extra dollars in support services personnel. We are hiring, have hired 1.5 custodial FTEs. We have been contracting out our custodial janitorial services in this building for the past several years, but we've been able to do an analysis and determine that slightly cheaper to bring those custodians on staff, and we've been able to give them benefited positions, which they didn't have at the place that they were contracted with. So it's a huge thing for us to be able to offer those positions and have hired them into. The reason it's so low is that it's just for the last few months of the year, so we didn't need to do a full 1.5 FTE as we would at the beginning of the year. But that's the personnel difference there. And then in community environmental health and family and clinic services, there's been some salary savings, so requesting that difference of 105,000 in personnel, increase of 279,000 in operating and 78,000 in capital, for a total change of 252,000 increase in our budget. And that's a summary of our budget revision, which would include 125,000 extra dollars for the mobile medical.
Excuse me. So as you guys understand, this is kind of a mid-year budget change. It doesn't look like any more revenue is asked for. It's just a moving of money around. Everybody understands that, I hope.
The increase in revenue is directly from contracts and grants. Some of that goes directly into operations for completing the deliverables of the grants, the operations side of it. And then there was the reduction. But the only increase in revenue is anticipated from contracts.
From contracts, not the counties.
Correct.
Okay, so I need a motion if you're in agreement to accept.
One quick question.
Okay.
So all the
Sorry.
card shuffling is in one budgetary maneuver. The transferring here, the transferring there is all in one revision. So if you vote for the one revision, you're getting all of it, all of the transfers and reallocations.
Change the revision as it's, and make a motion to revise.
Even on the
if you
county
were to
level,
choose
we have to
to.
go through a public hearing when we change our budget mid-year. It's gotta be
Right.
through public hearing process, and people are allowed to come in and ask, what are we moving around?
If you voted as is, it would be for all the
Yeah,
changes. If you
sure.
wanted to make a change, that now's the time to do that, or do it at a future session as well.
But voting for this right now doesn't necessarily mean we're buying a van,
Correct.
just allocating money for it.
Okay, everybody understand? Any more questions? But it's good with it. I entertain a motion to accept the budget revision for 2024.
I'll make a substitute motion.
Make whatever kind of motion you want.
Well, I would make a substitute motion to hold off transferring the 125 till at such time we actually have a van and a decision on which one.
How would that work? Just keep it in
$125 125,000 would just remain where it is until we actually
So
decide if and when.
in the personnel budget, it won't be spent, since that's where the primary move came from, the capital outlay. Or we could still move it into capital outlay, as we won't be spending it in personnel, and just not purchase a van until there's board approval. We could come back at the March meeting and discuss the van purchase itself. Like Commissioner Tucker said, we're not buying the van after we leave the meeting. So we could transfer it to capital outlay with the request to hold off on any purchases. And come back and make that an action item, a separate action item, or we could leave the 105,000 in personnel that was requested to change. But again, that's going to be a surplus in personnel if we leave it there. So what we do with the funds at this point is at the discretion of the board. Those are the options.
Well, I think the quick and dirty answer is if we do all the revisions and we come back in May at our next meeting and we've got a solid figure for the van, we can go ahead and approve it. If we don't make the revisions, we have to move that money out of personnel, and it's a whole other process like what Laurel's doing here. That makes sense?
Yeah. So I will withdraw my substitute motion with the understanding that I would like to revisit the van cost and purchase when we get there.
Would you be willing to make a motion to approve this budget revision as presented?
Yes, I'll make the motion to approve this budget revision as presented.
We have a second?
Second.
Got a motion and a second. Do we have to do this by roll call on a budget revision, or can we just go up and down?
Yeah, unless they want their vote.
Okay, and we lost Betty Ann somewhere in the process. So we got a motion and a second to approve the 24 budget revision. All in favor, please say aye. Aye. Anyone opposed? Motion carries. And we are just flying through this. Okay, next agenda item is to discuss and vote on amending the 24 budget Board of Health schedule. You should have this in your packet. Kind of looks like this. And I think the only thing was the May and October meeting. So I don't know who's putting, oh, you are.
Yeah,
You actually get to talk.
yeah,
Okay.
exciting. So the two changes, one was moving the May 17th date to May 10. Betty Ann did drop it. She said that will work for her. That meeting is the budget hearing in Valley County, followed by the regularly scheduled board meeting. And then I got clarification on the Idaho Association of Local Boards of Health. You all had provided input on that. I can't remember what meeting that was, probably December timeframe. So just as a reminder, the annual meeting is all 7 local boards of health from around the state get together. That there isn't a pattern as far as how it rotates. Last year it was Coeur d'Alene. This year it's going to be in Idaho Falls, and they are going to host it in Idaho Falls. That was another discussion point you might recall, whether we wanted to do it in a Treasure Valley. So they're going to do it in Idaho Falls on October 23rd and 24th, and we'll likely get agendas and things like that probably by sometime this summer as far as the plan. So I would request your approval to approve your approval of the proposed schedule.
October is football season, and some people may have football tickets.
Yeah, I know.
It could be an issue.
Deer season too.
Yes.
The cheer, that kind of stuff.
Okay. Approve the new dates.
Yep.
We have a second.
I'll second.
Move to second, all in favor, please say aye.
Aye.
Aye, motion carries.
Stay.
You're gonna be out there hunting. Gosh, I can't. Okay, so the 2-page agenda, this is amazing. Next agenda item, does anybody need a break before we move on?
This will be fast.
Okay, the next agenda item is director's report. Mr. Duke.
So Betty Ann is our trustee elected by this body, and in that role, she's also serves as the executive council. The executive council is one member from each board of health from around the state. We were planning to meet weekly. I told you I'd give you updates weekly. Well, they haven't. They met for the very second time Tuesday, and there is quite a few bills that have been introduced, and I'll just hit these real fast because we're into the lunch hour. And then I'll send you more information about that. It's always a little bit complex having boards of health weigh in on legislation. That's the point of having the executive council member so that they can talk about it and decide, like, do we want to take a position on it? It's pretty cumbersome to try to run every conversation back through each individual board to gain consensus for that. There has been no positions taken yet. You did that role for quite a long time, so you know the process. But just real quick, there's a House Bill 397, and it is to change the Idaho Immunization Reminder Information System called IRIS from an opt-out back to an opt-in, which is how it started. And the issue with the opt-in is the administrative process to get every single person, child immunization, every time they get vaccinated to get permission. It depends on which providers they go to. I'm sure you have this within your office. It was changed for the purpose of the few people that want to opt out, like on our forms, we make it clear on patient consent, you have the right to opt out. Here's how to do it. Otherwise, your records are going into the IRIS. So Stephanie probably has a better perspective on this. What I had always heard was there's like very few people actually were opting out. So it kind of made sense from an administrative standpoint to allow them to opt out through that process without creating this burden for most people, most immunizations. So we didn't really do an analysis yet on how that's going to impact us directly, but Health and Welfare estimates the first year would be between $740,000 and $875,000 just to reprogram IRIS, and then ongoing maintenance cost of over $100,000 a year. I don't have anything to argue or debate that, but that's what Health and Welfare provided. That's the organization that manages IRIS. So this bill did pass. Probably about party line vote in the House, and it's been sent to the Senate. Bill number 2 is House Bill 493. This is in state affairs, and it prohibits the state and political subdivision, public health districts, from mandating an individual in the state to use a medical face mask, face shield, or other face covering for the purpose of preventing or slowing the spread of a contagious or infectious disease. So as many of you will remember, like probably the 2021 legislation, when legislation started to be introduced, that there's a process in place. If we did it countywide, like Elmore County, everybody must wear a mask. If we as this board would impose such a restriction, it has to go back through the counties for approval. I think it's within 7 days. This, to me, is concerning from the perspective it's down to the individual level, and we Central District Health manage TB cases, as an example, all year. We have 5 to 6 individuals who are doing direct observed therapy, having them take their medications. And if that individual were a risk, like somebody who's unhoused with mental health and substance use concerns, we may ask them, we may require them to wear a mask when they're going into grocery stores and places like that while they have active TB, to clarify. And this would prohibit that. So The other legislation seemed to make more sense, where it's universal across a whole population, but this would prohibit our ability to enforce any type of restrictions.
And this doesn't affect the hospital saying everybody has a mask in a private setting, correct?
That's right.
This is only, and we never really mandated any mask. We suggested it to a lot of the schools, to a lot of the counties, but it was the county commissioners that made that decision. And it's not an easy decision, but at that time, I think it was the right decision. Now we have learned. Maybe we'll look at that differently next time.
So passed out of committee, do pass recommendations. So we'll go over to the Senate side. Next up, House Bill 525, powers and duties of the district boards of health. And this was somewhat perplexing to me. It was to change your powers and duties from to do all things required for the preservation and protection of public health, and to change that to do necessary and reasonable things required. And they basically preservation, protection of public health and preventive health, and to enter into agreements, et cetera, et cetera. So preventive health was originally taken out, but it doesn't matter whether it's in there or not. That's what we do to a great extent. So whatever discussions took place at the legislature, preventive was put back in or left in, and the revision is to do necessary and reasonable things instead of to do all things.
So that bill is, I think, in general orders now, waiting for amendment to leave. I watched the debate on that, and
Right.
preserve or prevent seemed to be the thing that got people a little twisted up.
Yeah.
Even though it could be argued that reasonable and necessary things are preventative.
Right.
So striking the preventative really didn't conclude preventative, but that bill is in general orders, probably waiting to be amended to leave the word prevention in there, and then just go with the one modification of all to reasonable and necessary.
Correct. And that the executive council's like, well, okay, reasonable and necessary versus all things. We, as in the Betty Ann and her 6 other colleagues around the state, didn't think it was something that we needed to fight or debate or argue about. Apparently somebody will be happy if it passes. I don't think it's going to impact what we're going to do for communities. I don't know.
I think the concern was that then it got into certain individuals' determination of what should be included in all.
Yeah.
And that it could be construed as more of an authoritative mandating type of environment, as opposed to taking the word all out that kind of closes the door on being able to mandate, I think was the thought process.
I think most of these bills that I'm obviously not the immunization registry are a continuation of conversation about how things were handled primarily during 2020 before we had vaccines, we had inadequate PPE, masks were not readily available, even to healthcare providers. So now we're in 2024 and we're proposing more bills along those lines. So probably have it be the case for a while. Other bill, Senate Bill 1227, and I will send this information to you so you have it along with links to the bills. This is the health rights bill. So the section be cited as the Idaho Bill of Patient Medical Rights. The state, a political subdivision or public health district cannot, and it goes through a whole list, order residents in general to remain in their homes, close their businesses, social distance, wear masks, advertise via any medium, electronic or otherwise, for the recommended public use of any vaccine, drug, or medication classified as experimental by a competent medical authority. So we'll have to figure out who that competent medical authority is. They'll decide whether it's experimental or not. And it was always emergency use authorization, not experimental, even though people tended to suggest it was.
Well, it was emergency use authorization because it hadn't gone through the normal vetting process. And
Right.
so by not going through the vetting process, people would argue that it is experimental at that point. I mean, it's
Right.
like semantics or synonyms or something. But that's why they were allowed to
Yeah.
mandate it. And that's why there was so much angst about other treatment options that were functional, is if there are other treatment options, then you can't have an emergency use authorization. So that's why there was demonization of other treatments, so that we could have the emergency use authorization, so that we could use a not fully tested product.
And then it'll be, that experimental will be determined by competent medical authority.
And I'm assuming that would be more at the national level.
We don't know.
Person.
There's no definition of that. So that'll maybe be debated next legislative session if in fact this passes. Next is Senate Bill 1287, jurisdiction of certain health organizations without an affirmative vote by both bodies of the Idaho legislature. State of Idaho is prohibited from implementing or enforcing any requirements or mandates from the United States Department of Health and Human Services and the Centers for Disease Control and Prevention. No recommendations, instructions, or guidance provided by either organization shall be used to justify any public health requirements, including but not limited to mask, vaccines, quarantine, and medical testing.
Wonder where that one's gonna go.
Hmm?
Wonder where that one will go.
It's been referred to health and welfare. That health and welfare. And then last but not least is a Senate concurrent resolution, number 110. This one's also about the COVID-19 pandemic, and therefore be it resolved, second regular session of the 67th Idaho Legislature, the Senate and the House wish to appoint a committee to investigate the conduct and overall response of the government of the state of Idaho to the COVID pandemic. The Legislative Council shall determine the number of legislators and members from each house appointed to the committee. That's been what I have is on the 17th of January. There's reported printed and referred to state affairs, and it hasn't, nothing else has happened since then. So for a month after it was introduced. Couple other quick items. So there's some discussion happening. No, this is not like anything we really need to talk about today, but some boards of health around the state are considering shifting their health districts fiscal year from state fiscal year, which we've been on since 1970, to county fiscal year. So instead of it July 1 to June 30th, it'd be October 1 to September 30th. So this, I'm sure, will come up in Idaho Falls this October. Laurel has started putting together some pros and cons. I think maybe one of our upcoming board meetings, she could share that with you. Just again, start thinking about it. Yeah, so no decisions, just awareness.
Well, and honestly, that makes kind of sense because the counties are taking over the whole health districts. I mean, anything we can do to make that budget process simpler would definitely help the counties out, but
Yeah,
it's kind of spinning your wheels in the sand.
yeah. I mean, what we have works, and our money comes into the counties throughout the year. It's not. I don't think there's any real great reason to do that.
Administratively, there'd be a bit of a burden to
Make that
shift to that, in terms of our audit, redoing budgets for that year. Do you over budget for one period, or do you do a smaller budget and then go through the whole budgeting process again when you make the transition? And then, as Russ said, we get our payments in throughout the year anyway, so it's not like we get them all October 1st from the counties. So to me, at first, glance, the administrative burden seems heavier than the benefits that it might provide, but I know the other financial officers in the health districts are talking about it, and they have been putting that list of pros and cons together so we can look at what it would mean for us.
And that's about it. There's some discussion happening around changing the Idaho Association of Local Boards of Health bylaws among the executive council. That would be something that will get drafts for you. I would envision by April or May for you to look at, and then that would be a vote decision that would take place in October.
So what are they looking at, like terms or something, term limits or?
There's still some, I call them artifacts left in there for the state association of local boards of health representative, which we're not members of NALBO anymore. So it's a lot of cleanup work, timing on what resolutions are introduced, what percent of, late breaking resolutions, 2/3 majority vote. So there's things that have been talked about, but haven't been, I guess, formalized in terms of the bylaws.
Well, I think that's kind of interesting because, as you guys know, IAC is our representative of the legislature. Wasn't really that much discussion at IAC about health district issues that I remember.
I think it goes.
There was a lot more energy spent on meeting your senator or representative of anything else, but be interested to see what they come up with. The trustees.
Okay, so the next, well, this is the final item that I have because I already shared the dates of the Idaho Association of Local Boards of Health meeting. This is a big deal, really, so I never heard of a 218 agreement, and then I was at a district director meeting, and a lady named Jackie McLeave came to the meeting from the state controller's office. She's a state social security administrator, and said, to let you know, you have to have your employees vote on whether or not you will continue to participate in social security. What is that? Question, is that related to like Health 316? Because we were never state agencies from the time we were created. And we've already talked to 316. And she said, no, it was really identified around 2016. And I think the identification took place when she started with the state controller's office, that we were out of compliance. And my last question to her was like, so we should have done this not in 2016, but in 1970. And she said, yeah. So all of these districts and commissions and irrigation, whatever, mosquitoes, anybody that was in existence when Idaho signed this 218 agreement, all these local governmental entities were included in that agreement. We were not. We never took the vote in 1970. When it was identified in 2016, I'm told we didn't take it to vote because of the mainframe system at SCO. It's going to be too complicated to carve off organizations like ours. So now we have LUMA, and now we have to take this to vote. The document I gave to you in your board packet explains everything. We're going to start, it's a 90-day, there's a 90-day window from saying, I guess we're going to start working on this, and then we're going to do lots of information sessions for our staff. We're going to bring individuals in from Percy because there's questions about how does this impact Percy. Everyone will get to vote. That's through your personal address. It'll include board members. And one of the things that I would let you know is it's a simple majority and it stands forever and ever once the vote takes place. Likely the vote will occur in June is what we were thinking. Or July.
I thought the state has to put on the election. We do our own.
Nope, they're managing it all. So,
Okay.
so Jackie and her team, they manage everything, who gets to vote. If you start after April 1st, you don't get to vote. If you quit before the vote, you don't get to vote. It's a pretty big deal. So more to follow. I wanted to introduce this to you. One of the decisions that the board will need to make, probably either in March or April or not, is if all of our employees chose not to continue to participate in Social Security, what do you want to do with the employer's share of the money we're currently contributing on behalf of the employee? You want to put that back into our operation budget? You want to match their 401k contributions? You want, there will be options. So planting a seed,
I say invest in cheese ball futures.
you could, that, yeah, and that may do better than interest. So,
I don't know about cheese balls. Some of us can't eat that stuff.
Well, nobody should. So that quip wasn't necessarily a endorsement of that nutritional.
So, you know, Russ, if you've been an employee, you've been paying into Social Security for 10 or 15 years, and all of a sudden you do away with having to pay, do you get that money back? Or that's just gonna get sent to you when you're retired?
you still will get Social Security, but there's some reductions in the amount you'll get. And that's about as much as I want to say about it, because I'm sure I will be wrong, is Jackie's going to come to the next board meeting to present to all of you, to give you more detail and allow you the opportunity to ask questions. She wasn't available for the meeting today, is why she's not here, which is probably not a bad thing, given the
So we're gonna
time.
put this one on a future agenda.
It will be on the March agenda.
States or whoever the agency is would save money and the employees would be out.
The employees won't have to contribute, so they'll get to
Will they
keep,
get it back?
right?
Yeah. And the state is down 6.2% or whatever that they wouldn't have to pay.
The state being us,
Whoever, yeah.
we won't have to pay,
Right.
so,
No matching.
Yeah.
There's some interesting questions because what does that do long-term if somebody's been into the system 1 year versus 20 years?
Well, vote accordingly, I guess.
What does that do to Social Security solvency?
Oh, I think it would bankrupt it. Took all the money out of it. What are they gonna do? I don't know, maybe I'm wrong there, but they're saying now it's 2032 before they're gonna have to make a change. About the time I get there.
so there you have it.
Okay. Anyone, any questions for Mr. Duke? Do we know, is there, I guess I can go up, is there any public?
I don't think anybody came in.
Well, there's one lady that came in at the beginning.
Yeah, there was no one out there when I stepped out for a moment.
She probably didn't want to stick around through all the.
Somebody's out there, so anybody else have anything they want to add to the conversation? If not, then I'm gonna adjourn this meeting. Good meeting.
Yep, thanks, everyone. It was
Well
a
worked on today.
long one. Sometimes we're done in an hour,
Actually, we did pretty well with some of that
sometimes
stuff.
4 hours.
No.
Because the other Cat Creek now.
Oh.
3:30.